Okay, good morning, everyone. Dr. Randall Gates, board-certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. Today, we're talking about benign paroxysmal positional vertigo and its association with thyroid dysfunction. We'll hopefully go through many of the underlying causes and reasons that you may be speculating about if you have BPPV. And we're joined by Kathy. Good morning, Kathy.
Good morning, everyone.
So, Kathy, did you have any questions on this? I know BPPV is a mouthful, and it takes some practice saying for anybody who's familiar with it. Say it 10 times fast, especially when you actually say the whole word in terms of benign paroxysmal positional vertigo.
Well, I did a little reading. As far as causes, they act like maybe some head traumas, maybe laying in one position a long time or something. What kind of head trauma you're moving these little rocks in your ears become dislodged.
Right.
And then they act like all of a sudden this can just happen. So what's your thoughts on that? How can something like that just happen?
Well, and I'll bring up the diagram. And thank you, everyone, for the feedback from last week when we talked about Meniere's disease. A lot of people like the visuals, and that was Kathy's idea, because I'm notoriously horrible at getting all the visuals out. So we got visuals again this morning. So how does trauma affect BPPV? So in essence, here's the diagram of the inner ear. And when we hit our head, keep in mind that within the inner ear and this region, that these calcium carbonate crystals are on a gelatinous membrane. It's kind of like sand on a layer of jelly on top of your bread. That's kind of what it's like. So when you hit your head, it can lead to those crystals dislodging. So that's basically how it works. It's just a pure force element to that part of the inner ear. And I was reading an article this morning, and they were talking specifically how the crystals in the inner ear are made of calcium carbonate, whereas the calcium in our bones is calcium phosphate. And calcium phosphate is much more resistant to the effects of acid. Now, when there's an injury, pH can sometimes be affected by the inflammatory response. So there's a lot of discussion now, is inflammation affecting pH on a subtle level, which is then affecting the inner ear. So it may just be a blunt force trauma, Kathy. It could also be the effects of, the inflammation throughout the body or in the brain or in the inner ear that's then leading to the crystals dislodging.
Okay, when we discuss all that, then the first thing that comes to my mind is because we've done all the concussion series, do we see a lot of this in athletes?
Yeah, I've seen quite a bit of this in athletes who have vertigo. So particularly if you are if you've had a concussion and you're having dizziness, even if it's nebulous, even if it's not the room spinning around you voraciously, you want to think about BPPV, because BPPV is very common in that setting. I've seen it a lot. And lots of times concussion patients are just told, you're dizzy because of the concussion. That's not necessarily true. And good morning to everybody who's joining. So
what's the connection between a thyroid problem? How that's associated with BPPV?
So in the elderly population, BPPV is actually a pretty big deal. Dizziness is one of the most common reasons why the elderly see their general practitioner. Anytime somebody's dizzy, the doctor has to rule out like a cardiac problem or a vascular issue in the neck, making sure that's not what is causing their dizziness. So then lots of times dizzy patients are referred to balance centers, to ear, nose, and throat offices. They go through a long workup, and BPPV is the largest segment of the practice for dizziness clinics. And so when these doctors keep evaluating people who have recurrent BPPV, they start saying, well, why? And so that led to the research on association studies. So they started looking at, is gout associated with BPPV? Is vitamin D deficiency? Is low bone mineral density associated? High cholesterol? Basically signs of high neutrophils compared to your lymphocytes. There's all these different markers that people are looking at. Thyroid was also one of them, Kathy. So around the year 2000, researchers started looking at an association between thyroid autoimmunity or thyroid dysfunction and an increased chance of having BPPV. That since has been totally established. Basically, if you take, let's say, 100 people who have Hashimoto thyroiditis, which is where the immune system attacks the thyroid, 20 of those 100 will have BPPV. So BPPV is much more common in people who have thyroid autoimmunity, and they have seen that individuals with recurrent BPPV, I wish we could just call it something else. I keep saying BPPV. But, you know, people with this recurrent condition of crystals in the inner ear have a much higher association with abnormal thyroid hormone tests as well as with immune counts to their thyroid. So that's kind of the association.
Okay. So what can people do about BPPV?
What they can do is, first you need a really good diagnostic workup, and this is throughout the literature. I just read an article this morning where they're basically saying all this, that lots of times when people have BPPV, they go to a physical therapist after they've seen the ear, nose, and throat specialist. In my experience, lots of times goggles are not used. So Kathy and I have talked about video nystagmography. That's where you put these goggles on the person. You can really see the eyes with a lot greater detail. For patients who have this inner ear condition that we're talking about, it's even more important because you can actually look at something and prevent your eyes from moving. So even if you have an inner ear vertigo condition, if you have good frontal lobes and good gaze fixation centers in your brainstem, you can be taken back and have this BPPV and it won't show up because you can look at something. So that's where having goggles on is so important. And the goggles really characterize how your eyes move. And going back to our diagram, so each semicircular canal here, because the crystals dislodge from this region, and then they can go into one of the three different semicircular canals, the horizontal, the posterior is the most common to be affected. I have a hard time orienting going, it's always backwards here on the video. But the posterior canal is the most commonly affected canal with BPPV. Well, believe it or not, if you activate your right posterior canal, or if you have crystals in there, your eyes are going to move a characteristic way, versus if the crystals are in the horizontal canal out here, then your eyes are going to move a different way. And there's also a lot of nuances. Where are the crystals at in the canal? This is particularly important for horizontal canal vertigo. So if your crystals, let me see here. There is a diagram here of the cupula. You can kind of see it. Here it is. Okay, so, all right, so you all see that part of the diagram? That it looks like a little, kind of like a sail. Well, the sail is actually what senses fluid movement in the inner ear. And so sometimes the crystals are out here in the canal. They may be back here in this portion. They may actually be adhered to this side or that side. So it all depends on how your eyes move and what head position. That's where getting a really thorough VNG performed with somebody who's pretty accustomed to treating this is really important. So that's what I'd say, my long-winded answer to your question, Kathy, in terms of what they can do.
But are most people just going to see an ear, nose, and throat doctor?
Yeah, no. I mean, a lot of them will go to the ENT. The ENTs basically do the evaluation, refer patients to the audiologist. The audiologist will do the Hall-Pike maneuver on you. That's where basically you're sitting, you lay back really quick with your head to the right or your head to the left, and head is extended. If you have recurrent dizziness, it's really important to ask your doctor about horizontal canal vertigo, because lots of times the tests for horizontal canal vertigo are not done, and horizontal canal vertigo is actually much more common in the elderly population than those who are in their second, third, and fourth decades of life. So does that answer, Kathy? I don't know if that completely answers the question.
Yeah. I'm just thinking of some of the elderly folks I've dealt with who all seem to have issues with balance and that sort of thing. But I've never really had a doctor ever talk about any of these things or ever even look at those for the elderly folks that I've worked with. So it's interesting to me. And I know there have been times when this has probably been part of their problem. So what can you tell me? Why is the thyroid problem so much more prevalent? What's going on with that?
Okay, and I'm going to circle back to that. I want to hit the point of dizziness. So
Okay.
when we do these talks on dizziness, we actually have a lot of feedback. They're probably some of our most popular talks, and frequently patients say, why does my doctor never tell me this? I've never heard this. Basically, everything we're telling you comes from the ear, nose, and throat textbooks. It comes from the world's foremost researchers on ear, nose, and throat disease when we're talking about dizziness type stuff. So why is it not done? I don't know. It just seems like there are certain physical therapy centers that are really interested in it, but if you're an ear, nose, and throat doctor, cutting out like a sinus tumor may be more exciting than dealing with someone who has this nebulous condition of BPPV. And I'm not being insulting there to the ear, nose, and throat doctors at all. I'm just saying I hear patient after patient coming in saying, I have dizziness. No one really seems to care. No one really seems to ask these questions. And all I can say is that we find dizziness as a very interesting thing. It's one of the main things I love treating. And so I think when you have a passion for it, it's a lot easier to treat it. But I do see a lot of patients who have dizziness. And also, too, in the medical world, like they're worried about ruling out something really ominous. Do you have a heart arrhythmia? Which actually, heart arrhythmias are more common with BPPV patients. Just note that. But do you have a heart arrhythmia? Do you have atrial fibrillation? Do you have stenosis in one of your carotid arteries or vertebral arteries? Are you having strokes? Do you have a tumor in your vestibular nerve? So your vestibular nerve, which you can see right there, that can develop tumors. So do you have a tumor there? So that is what your doctors are thinking. Once they rule all those things out, they're like, okay, well, you don't have anything really bad, so I'm not going to worry about it. It's kind of like the patients who have bowel problems. They go to their gastroenterologist, and the GI specialist does all these tests, and they rule out cancer, so then they relax. But then the person with IBS lots of times leaves the office without a lot of good solutions. In our experience, this is what we hear. So circling back to why is the thyroid so much more commonly, why do we see this epidemic of thyroid issues today? It seems to be a confluence of factors. More and more people seem to be reacting to gluten. We can speculate why. I'm not going to do that in this video, but gluten seems to be a big issue. Also, we see changes in gut bacteria with thyroid patients. The American diet has shifted towards higher processed carbs, higher saturated fat. That has definitively been linked to changes in our gut bacteria, 37 trillion of them in our intestines and colon. Iodization of our salt seems to be an issue. Iodine is known to be really good for your thyroid, and we need a certain amount of iodine for our thyroid. However, the Dan-Thyr study, which is pronounced D-A-N-T-H-Y-R, the Dan basically is a Danish thyroid study, came out, and they showed that once they started iodizing salt, thyroid incidence went way up. So we're probably getting too much iodine in our diet, which is decreasing selenium in our thyroid, which is then allowing for autoimmunity and potentially for viruses, which have been linked to thyroid problems, to proliferate. Also, vitamin D deficiencies are associated with thyroid problems. So all those things, changes in the foods we're eating, as well as then iodization of salt, are probably why you're now seeing some estimates that like 1 out of 3 females around the age of 50 have this autoimmune thyroid condition. They can't lose weight, their hair's falling out, and that's why you have all these thyroid support groups online, and that's why you have all these thyroid books out there now. So thyroid's an issue, and as Kathy and I discussed, we deal with thyroid a lot, and we're very familiar with it, but it's interesting how the thyroid ties in with these other neurological and, ear conditions and things like that.
The interesting thing I saw on the BPPV was that eventually, in most cases, it just writes itself. How does that happen? Do the little stones reconnect themselves?
Great question. So the little stones, and I should have been using this part of the diagram, but the little stones, they're like golf balls. And they're like a bunch of golf balls in these little canals. Oh gosh, okay, going out here. So when you have these golf balls out here, sometimes the golf balls will form a plug. It's like they will adhere together, and then they'll move through the canal like the International Space Station. You can think of it that way. And then at other times, the golf ball clump will dissolve, and then they'll go back into their little golf balls, and then they'll go back into their home, so to speak. I always love the movie Happy Gilmore, where he's like, don't you want to go in your home? Talking to the golf ball. So sometimes those golf balls go back into their home. But in a lot of people, they don't. So BPPV is called benign paroxysmal positional vertigo because it can spontaneously remit. It's talked about a lot in the textbooks that if you just do the testing for BPPV like 2 or 3 times, that testing taking the head back and forward creates, pressure in the inner ear that's then going to allow those crystals to dissolve. And lots of times that will be enough to basically treat the individual. But that is more for, in my experience, that's more for the benign paroxysmal positional vertigo affecting the posterior canal. The posterior canal variant, which you see better down here, is the most common variant, and that is easily treated. The difficult cases that I see are involving the horizontal canal, and these individuals commonly don't have the assessment that I would like to see before coming in the office, and they tend to be harder to treat because in the horizontal canal, it's really common for the crystals to be back here or adhered to the cupula. That's what that is called. That sill-like mechanism is called the cupula. So if you hear your doctor say canal lithiasis, that means the crystals are in the canal. Cupula lithiasis means the crystals are attached to the sill. So hopefully that's not too technical.
With head exercises? How is that treated?
Yeah, it's basically treated by positioning the person in a certain fashion to try and get the crystals to literally start moving in the right direction of the canal and eventually almost like thread them back into the utricle where they came from most commonly. Utricle saccule, that region, the autoconia. And then we had a question from a fellow colleague for horizontal canal vertigo. Will the patient present with nystagmus as well? Really great question. So yes, if you are doing a VNG, commonly these patients who have horizontal canal vertigo, in my experience, just doing it visually, you won't see the nystagmus as often. So with the posterior canal variant, you probably will, not always, but probably. So you take that person back. Some people can visually fixate, but that nystagmus is referred to when it's involving that posterior canal through here as a vertical torsional geotropic nystagmus. So the eyes, for everyone watching, will literally do this. So it's pretty easy to see because the eyes are just really kind of ripping, so to speak, in that nystagmus pattern. For horizontal canal vertigo, it's more like this. But because people are used to dealing with it, lots of times they can keep their eyes pretty stable because you don't have that torsional component to the nystagmus. So for horizontal canal vertigo, wear the goggles to see the nystagmus. Okay.
So the VNG pretty much gives you all the information you need.
It does. It's really important. I know earlier when I started into practice, I was working with, they had these things called Coke bottle glasses. Basically, you have to have something that you can put on their eyes where an individual cannot fixate. So Coke bottle glass is basically looking through 2 magnifying glasses, like glasses where you look through magnifying glasses, so you can't actually focus on something, and then the eyes are really blown up huge, and you can see the nystagmus pattern. The VNG is nice because the recording software tracks every eye movement, and you see a definitive graph. It's like getting an EKG, you get a definitive graph on the computer as to what exactly is happening.
Okay.
And then one thing I did want to highlight on, just to confirm, diabetes is also associated with BPPV. They're seeing hyperlipidemia may be a factor. Interestingly enough, vitamin D deficiency and low bone mineral density have not been substantiated as causes of recurrent BPPV, and that would be the normal line of thought. Oh, you have a vitamin D problem because that affects calcium metabolism, or oh, you're osteopenic or osteoporotic, and your body is eroding away bone, so it's going to erode away the calcium carbonate crystals in your inner ear. Actually not showing to be true. And so that's also something to be aware of. I have seen, though, some patients who are taking calcium supplements and they developed BPPV, and we took them off the calcium supplements and their BPPV stabilized. So I don't know, just telling you what's in the literature and what's in the research. And yeah, I think that's pretty much what I had to say. Anything else on your end, Kathy?
No, I think that gives us a pretty good description of the BPPV.
Okay. And also know that a lot of what we talk about with BPPV is theoretical. It's really hard. Like, we can't see the crystals on an MRI really at this point. We're actually seeing a lot more in the inner ear with MRIs. We talked about that relative to Meniere's disease. And so we can't see the crystals. So a lot of the studies on crystals have been done post-mortem, where they actually go in after someone dies who had BPPV and they look at their inner ear and they can see these like plugs of crystals. So that's where in the literature they'll say, you know, we know a ton about treating BPPV. We know a ton about its presentation, but we actually don't know a lot about the histology or the pathology of it. So what we're going off of is what we know from literature. So I think that's it. Let me see if we have any more questions. Okay, and we had a question. We recommend vitamin D to be 60 and above. What would your recommendation be? I would say, yeah, I try to keep it around 70 in our patients. So vitamin D range is 30 to 100. Most typically, I try to keep it around 70, but 60 is quite adequate as well. So great comment, great question. So thank you everyone for watching. Have a lovely weekend, and Kathy and I should be back next weekend with something else. If you have any topics relative to dizziness you want us to speak on, let us know. Otherwise, we will see you soon. Have a good weekend, everyone. Let's see here, that one.